Hey everybody, Kevin Henry, editor-in-chief for drbicuspid.com. Thanks so much for joining us for another episode. Thrilled today, as always, to be joined by my dear friend and colleague here at Dr. Bicuspid, and that is Kelly Tanner, PhD, RDH. My friend, how are you?
So good, Kevin. Great to be with you again this month.
Hey, I love talking to you because I know you've really got your finger on the pulse of what's going on out there with dental hygienists. And as we get into this last part of the year, because we know once school starts, it's a mad dash to the holidays, and then all of a sudden it's 2026. So what are you hearing from hygienists as summer starts to kind of creep toward its end?
There's still so many things swirling in dentistry. And some of the questions that people have posed just in conversations I've been listening to in person, they said, oh my goodness, who knows where dental hygiene will be in a year? Who knows what's gonna if the word dental hygienist or RDH will even be a thing. So what I think that they're talking about is how stable dental hygiene is as a profession. And with me, from my perspective, it's just how my mind works, Kevin. I just see opportunity. And I can't help but think that way. I see what they're saying with some of the things in other positions potentially taking the place of, or and other regulations and other lawmakers doing certain things that may quote threaten us. But I think that this is a true opportunity to lean into what we do and who we are as a profession and what we are as a profession.
You know, you and I have discussed the oral preventive assistant. We've discussed some of the other things that are bubbling out there that I know hygienists definitely have an eye toward to see what's going on. Do you feel like that this is a time for dental hygiene to kind of put its flag in the ground, for lack of a better
I
term,
do.
how valuable you are?
I really do. And one of the groups that I work with is the I'm trying to remember the name of it, but they're it's like the brand awareness of what dental hygiene actually does. And we have taken on our own kind of flag to say we need to be responsible for bringing to the public who we are and what we do and how we protect their overall health, that oral systemic link, because no one else is going to do it for us. Even the professional associations, whether it be ADA or ADHA, that's not necessarily their only focus. They can't be so myopic to run these big billboard ads to say, okay, we're going to put our flag in the ground on who we are. Here's our definition and how we help people. So there comes a time when we have to take it on ourselves and we have to do it. And so we get to tell our story, which I think is the exciting thing. And I think in telling our story too, Kevin, that we get to rediscover what we fell in love with. As burnout is so common in every vocation, it's not just unique to hygiene. I mean, dentists are burning out too. They talk about it all the time. I think to always get back to that why, but yes, to put our flag in the ground to say this is, and to educate people on that we're not assistants. This is what we do to help the public is 100% where it should go.
And is part of telling that story reminding people of what it takes to become a dental hygienist, the education, everything that goes into becoming that dental professional that our
100. Oh
RDHs
my gosh. 100%. I didn't mean to cut you off,
No,
but
no, please.
100%, because so many people I know, as I'm chair side, people say, so are you a dental assistant? Or not that there's anything wrong with that. They just don't know. Right. And because a dental assistant, man, they're the other badasses of the
Well, you
office.
know my
Right.
passion for that, but hey, yeah.
Yeah, but to educate on what the difference is and to elevate dental assistants too. And with their education, because there are certain things that they do that I have no interest in doing, just like I have no interest in doing certain things that a dentist would do. And I would challenge anyone who thinks, challenge in a kind word, but to actually state that hygienists don't want to be dentists. If we wanted to do that, we would go back to school. But to educate the public, the Oral Health Awareness Project is the name of the movement that's going on. It just came to mind. So they're hiring a marketing firm to bring the awareness to the public to educate.
And you mentioned hygienists not wanting to be dentists. I will tell you, a lot of assistants I talk to don't want to be hygienists. I mean,
Yeah.
they really don't. They love what they do and they love being able to do different things depending on what the state laws allow them to do. So I think that there's a lot of things with dental hygiene right now that there's this carving out of making sure that it stays, dare I say, as a silo or its own brand itself, and really making sure that there isn't that infringement.
Yeah, there's burnout, which is very common, but it's not inevitable. And there are ways the way that I see it, Kevin, is remember who you are and why you're in it, right? And then think about all the things that you want to do. Like what would you love to do? So what do you love to do? What do you not love to do? What do you love or not love about your job right now? So what in that can you change? What do you have power over? If you feel like you're not happy in an office, have you talked to doctor? Have you advocated for yourself? Does anyone know that you're upset? So are you holding yourself accountable for the part that you need to play in the resolution of the issue? And if you feel like you are not getting enough variety, temp, go temp. There's all kinds of things like you have control and flexibility over that. You can go to different private practices where the patient loads are different, and investing in ergonomic equipment, advocating for themselves. And then there's always pursuing those other career alternatives on the side of it. And there's so many support groups. I have a page that is I don't know if who is listening here, it's called the Next Level Dental Hygiene Career and Personal Development Facebook page. Love to have you. It's an environment. And there's other ones out there that there's community of people who you can say, hey, I'm experiencing this. What would you do? Or what's the right thing to get that litmus test on whether you want to stay or go?
You know, I want to ask your opinion on something, because one thing I heard at the start of this year was that there was a movement in hygiene that part of the unhappiness came from hygienists felt they were too rushed with their patients. It was from the scheduling side of things. And I heard from several hygienists that like things would just be better if we could have a few more minutes with each patient and move those appointments out a little. Is that still a thing? And do you think something like that would help with burnout, would help with unhappiness? I mean, just your opinion here.
Yes, it's happening. It's still happening. And it's still a pain point because they'll try to make so I'm helping hygienists and coaching hygienists too, what they need to bring to doctor to say, okay, here are the services I'm providing. Here's how we're serving our patients. And doctor has to run a business. I get that, right? And so it's the pressure of that too, which as a business owner, I think PS everyone should own a business for a year to understand what that's about, right? To understand what it takes to open the doors to something to keep it going. But to have a conversation of what truly goes on in that chair and about the value that they're providing. And so I'll coach hygienists to bring that information to doctor. And sometimes the doctor is open to that. And you can't just wave a wand and start to open up appointment time because the schedules are so stacked anyway, but you can look 6 months out to start to increase that appointment time out for more time based on that. So it may not be available to you that day, but to come up with a plan with the office manager, with the doctor, the team, the DSO, whatever that is for you, and to say, this is how we are going to build this moving forward and to make that a team effort. And there's so many valuable services that are provided that need to be coded for too. So hygienists, code your procedures, use the appropriate procedure codes. And that bakes in that value too of what you're providing.
So if we're worried about where dental hygiene is going, and if there's really going to be an RDH in the future, what is that marketing message we need to get out there now? Is it that the health and how dental hygienists make a difference, or what do you think's the main focus should be?
It's always about how they're serving the patient. I really think that consumer awareness is a part of it, because when you're any law, anything that's going on right now, so it's a couple of different things, Kevin. One point is, because I think it's a layered approach, forming the patients about who is caring for you and what they are doing for you, because then the patients can advocate also for you. Because when you think about what happens at the General Assembly and at the White House and all the different areas that decisions are made legislatively, we advocate for our profession and show up in grassroots way, but then it's also the public that speaks the truth into that as well, because it's who they're serving. And so that advocacy effort Also, having other folks understand what services you are providing, like telling the rest of the office what you are doing and teaching them about that, because we all have our preconceived notions about what an office manager does or what a dental assistant does. I then really don't think that we know what each other does to help empower the other person, because with that understanding, you're elevating that other professionals. And then the third part is obviously, with the insurance reimbursements. We know that that drive has is a driver in this, because as reimbursement rates are going down, the pressure goes on with the docs to keep up. And so how do we change that system? What is our role in that? And also to tell a better story to the patients too, to have them informed, because still when I'm on the Nextdoor app, I'm not sure if you guys have that,
Who to do?
wherever you live, I'm looking at places I've worked before, and there's still conversations in those app going, I'm not going there anymore because they didn't tell me that XYZ, that they were dropping XYZ carrier, like Delta or whatever they're deciding to drop. And now I'm left with this big bill. So how are we informing the public of that consistently so everyone is seeing it? So again, the consumer can put pressure on these larger corporations or wherever it needs to be placed with the means of education. So education is where it's at.
It's funny you say that because I had a talk with my neighbor just the other day, and one of the things that he told me was that dental assistant was so nice whenever she was scraping the gunk off my teeth. And I went, okay, first of all, it was the hygienist. Second of all, it's not scraping. I mean, there were so many things just in that sentence that I went, I wish that somebody would have told him this is what we're doing and this is who I am. But it feels like it was just one of those things that he walked out of there not understanding even what had happened, other than, well, I had to go in for my 6 months, so I did it, check.
Display your license, display your diploma in your operatory in a place where it's going to be not get contaminants on it, obviously. But I always think about, microbiology ruined me for the rest of my life, but put it in a place where it's visible to your patients and who you are. Certificate, completion programs. Show your patient who you are. So I say that starts a great conversation of, I didn't know that you had to have this degree. I didn't know that you had to be certified in that. I didn't know that about you. What I found when I started putting my diploma in my practice was a game changer. So that's a place you can start if you have a place for that, so patients can visibly see that. It's for assistance for anyone.
Absolutely. No, I agree with you. And I'm sure you've walked in and the patient hasn't been on the chair. He or she's standing there reading the diploma or, trying to figure out exactly what it is. Hey,
Yeah,
last,
you went
yeah,
to ODU, so did I. I didn't know that. You're connecting too in
true.
different ways.
So last question for you. If you and I are talking a year from now, and what do you hope to have seen in the hygiene profession happen in that year?
I hope that we all own who we are and what we're doing through the advocacy efforts that we're doing, Kevin, and for everyone in the profession to value that. And for, it sounds like world peace, right? But for any profession, I mean, dentists, I feel like have this. People value a dentist, people value a physician, people value an attorney. So there's not awareness on what the profession can do and what we're capable of. Because I think with that standard, with that gold standard of who we are, what we do and what we stand for, then once there's the awareness of that, we have the ability to plug in the places that we've always wanted to, because now everyone's educated about what we can do. And there's not we're more in an abundance mindset versus a scarcity mindset.
Well, you can absolutely read a lot of Kelly's thoughts and listen to our past podcasts here on Dr. Bicuspid. So very easy to find. Just search for Kelly Tanner on Dr. Bicuspid. But I want to make sure people know how else they can find out more about you.
Yeah, thank you, Kevin. You can go to drkellytanner.com, teach on courses, also Next Level Dental Hygiene. You can like, share, subscribe to Next Level DH on Instagram, all the things. And if you want that professional coaching, we have monthly group coaching as well. It's cool. We speak on different topics. Like last week was about how to connect on LinkedIn and how to build your LinkedIn page. So this isn't only clinical skills, it's how to develop you as a professional. So you can go onto my page at nextleveldentalhygiene.com and find more information there.
Love that. And always love hanging out with you, Kelly. Appreciate the time, my friend.
Thank you, Kevin, for all that you do. And thanks for everyone for all the things that you do to care for our patients.
Absolutely. And we appreciate you taking the time out of that care to listen to this, because we want to see what's coming, not only for the rest of this year, but down the road as well. So Hey, make sure you check out Kelly's writings, podcasts on drbicuspid.com. And until next time, it's Kevin Henry, editor in chief of Dr. B, signing off. And as always, wishing you nothing but success.
Thanks, Kevin. Thanks, everyone.